Yes.
So we finished renal, GI. Now we are taking endocrine, and endocrine embryology is really easy, and there's no, a lot of information to grasp. So we're only going to take thyroid embryology. So how does the thyroid develop? We will take the pituitary, so anterior and posterior pituitaries, and the parathyroid glands, and that's pretty much it. So here's a picture to remind you of the normal embryology. Let's go back to review a little bit of embryology. So we start with a sperm and an egg, and both bind together to form the zygote. The zygote keeps dividing, right, till it forms the morula and then the blastocyst. The blastocyst is simply an inner mass and an outer cell layer, right? The inner mass becomes the baby, the outer cell layer becomes the placenta, and then the inner cell mass differentiate into the epiblast and the hypoblast, and then gastrulation forms 3 disc layer, which is the ectoderm, mesoderm, and the endoderm, right? And then the baby does something called embryonic folding, which is basically 2 direction folding, so craniocaudal and lateral, right, in order to form the shape. So this is craniocaudal, so it becomes like this, and also lateral. So if you take like a cut section from the patient head, so if you could imagine, this is like the top of the embryo head, you're gonna see the lateral folding. Okay, so craniocaudal folding, the lateral folding, right? And you could see the endoderm right here forming the gut tube, right, starting from the mouth till the part of the mouth till the anus, right? And then you have the mesoderm forming the muscles, skeletal muscles, cartilage, bones, etc. And then you have the ectoderm forming the skin, hairs, nails, central nervous system, right? So if you are asking about the thyroid gland, so which part of these structures does the thyroid gland develop? So it arises from the endoderm, okay? So we already talked about the esophagus, right? If you can think of this, we have the esophagus here, and we have the foregut, we have the midgut, right? And we have the hindgut, correct? So above the foregut, we have the primitive pharynx, okay? And this area is supposed to become the pharynx later on, okay? And it has different structures, right? It's very complicated. We're not going to take all that today. I'm just going to show you the thyroid gland, okay? So there are some structures here that are formed. They're called the pharyngeal arches. We're not going to talk about pharyngeal arches in the endocrine section. We're going to talk about them in the neurology section. So don't bother yourself with them now, okay? Anyway, so these pharyngeal arches are basically structures that have 3 different layers, okay? Forget about them. Let's just focus on the primitive pharynx, okay? And the primitive pharynx is covered from the inside by the endoderm, right? So this is endoderm, okay? So if we see the picture here, this is the embryo, right? This is the primitive pharynx, and underneath the primitive pharynx is supposed to, you have the foregut right here, right? The foregut. It's going to form the esophagus down till the duodenum, right? So where does the thyroid develops? As you see here, this is going to be the anterior 2/3 of the tongue, this swelling. And the tongue, by the way, also arises from the endoderm, from the inner cells in the primitive pharynx here, okay? So it arises in the endoderm right here. You have a swelling, right, which forms the anterior 2/3 of the tongue. And you have another swelling which forms the posterior 2/3 of the tongue. And in between, the thyroid actually develops. These cells condense to form something called the thyroid diverticulum. And diverticulum is simply, an outpouching, right? Like Meckel's diverticulum. So the thyroid diverticulum is a pouch of cells that is, outpouched, and then it starts descending from the back of the tongue, or the midline between anterior 2/3 of the tongue and the posterior 2/3 of the tongue. Then it descends to the neck, okay? As you see here, from the tongue, it descends to the neck. And then you see eventually it, stops at the neck here. And then these cells eventually develop. This diverticulum that's being formed is gonna, undergo cell division, and then it becomes the 2 lobes of the thyroid gland, right? And then between the thyroid gland and the opening here and the diverticulum, you'll see something called the thyroglossal duct, And from its name, it connects the thyroid with the tongue. Very easy, right? And this channel right here is supposed to be obliterated. So you're supposed not to have this channel right here. But if it remained, right, you could have a cyst, right, that's going to be filled with fluid. Or you can have, these cells are going to develop into another thyroid tissue as well, another lobe. And at this time is going to be the pyramidal lobe. So it's going to be another lobe of the thyroid gland that you could actually palpate on the patient, okay? And this is pretty much the thyroid development with a little bit more information. I'll talk about it in a minute. So these cells that develop from the endoderm are the follicular cells. So if you guys know the thyroid tissue, it's basically follicular cells and parafollicular cells. And I talked about the meaning of follicular cells before. So the meaning of follicle is basically certain cells that form a shape of a circle and they surround some kind of a secretion. This is the meaning of follicle, okay? So when I say follicular cells, I mean the cells that's making up the follicle. So these cells right here, okay? And the parafollicular cells are just cells outside the follicle. So they are para, so they're beside the follicle. And this is the basic structure of the thyroid tissue. You have lots of different follicles, right? And parafollicular cells. This is the thyroid gland. So the follicular cells arise from here, from the thyroid, in between the tongues, okay? And there is something about this cyst here that basically they like to test you on the boards, which it moves with deglutition. So when you're eating, for example, or you're swallowing, right? You're using your tongue to swallow, right? To push the saliva back and swallow. So you're moving your tongue when you're swallowing. And with swallowing, you actually move the cyst along with it. Because remember, it's thyroglossal. It's thyroid and glossal, tongue cyst. It connects between the tongue and the thyroid. So when you swallow something, you move the thyroglossal cyst along with it. Okay, and this differentiates it from something called the branchial cleft sinus or cyst. Okay, and I'll show you two cases right now for it on how it presents on the boards. So what are the abnormalities that could happen? So first of all, the thyroglossal duct cyst that we talked about. We also could have a problem with the migration. So we could have normal development of the thyroid right here, but the thyroid doesn't actually descend to the neck. So you get something called the lingual thyroid or the tongue thyroid, which is basically the origin of the thyroid. As you see here, this patient, you could see the thyroid tissue here in the back of the tongue, right? Because this is the area where it actually develops, right? So what happens if you remove this? So most of the time, the lingual thyroid is just all it is, all the thyroid tissue that is, right? And nothing develops otherwise, because this is the origin and it has to descend. If it didn't descend, that means we have no thyroid tissue in the neck, right? So basically, if he has a problem, most of the time he has problems with respiration or with eating or whatever. So we remove the thyroid tissue and plant it somewhere else, right? So thyroglossal duct cysts manifest, the cysts that we talked about here. They manifest as midline masses, neck masses that move with swallowing or protrusion of the tongue. So when you protrude the tongue, you also move the tongue, right? So it also moves, the cyst moves along with it. And they are differentiated from another cyst, which is called persistent cervical sinus or persistent branchial cervical cyst, which leads to pharyngeal cleft cyst in the lateral neck. And you have to know it's a lateral neck. And we're not going to talk about pharyngeal arches here, but I think I have a picture. I want to show you how it looks like. This is another picture from the origin of the thyroid gland. The origin of it is called the foramen cecum. So when the thyroid gland leaves and descends from the tongue, it leaves a depression. This depression is called the foramen cecum, and you have to know this, high yield. Okay. Why? Why is this important? Because during physical examination, you could actually see the foramen cecum normally existent. Okay. And if you have problems with the thyroid from, like a congenital abnormality, you wouldn't see a normal, proper developed foramen cecum, right? You would have some kind of a problem. If lingual thyroid, you wouldn't see the foramen cecum at all. And then the course of the thyroglossal duct, right? Because when the cells are descending, they're actually making like holes, right? They are, depressing themselves. So they are forming a duct. And this duct could form a cyst right here, or right here, okay? And during this development, the thyroid could stop at any point, actually. It could stop in the, like right here, here, it could stop here, right? So you have multiple different locations. For example, here, you could see a thyroid gland here, here, right? It could descend even more, and you could see a retrosternal thyroid. And sometimes we palpate the patients. I saw a patient with a retrosternal goiter or thyroid before, right? And this happened because of the improper descent of the thyroid gland. Okay, so now we talked about the source of just one type of cells, which are the follicular cells. What about the parafollicular cells that are right here, that are very important secreting calcitonin? What about them? So I'm pretty sure I have a picture for the pharyngeal arches here. Okay, so what are they? What are these? I want you to imagine something. Let's go back. So remember this primitive pharynx that I talked about, and this is the foregut. Well, actually, if you go inside the primitive pharynx, this is what you see. Okay, I want you to imagine this as if I'm looking from the posteriorly at the pharynx. This is the pharynx, and I'm looking posteriorly. So I'm opening the back of the embryo. This is like an adult, but this is an embryo. So I'm opening the back of the embryo, and I'm looking at the pharynx here. And you could see something called the pharyngeal arches. You could see like elevation bars like that, right? And you should only know something, and you could imagine something, that the endodermal layer of the primitive pharynx really outpouched. So you could see pouches here, elevations that the endoderm has done, right? So try to imagine with me here, like in this picture. So the primitive pharynx formed some pouches, right? That's what happened here, some pouches, right? Why are these pouches existent? Because each one of these pouches will form some kind of structure in the neck, the head and neck, right? So this is endoderm for sure, because you're looking in the middle of the pharynx. So this is the endoderm that you're seeing. And on the outside, this is the ectoderm, of course, okay? And the bulk itself is made from mesoderm, because, mesoderm is the middle layer, like we said. And from the inside, it's called the pouches, because it's out pouches, right? It's pouches out, came out. And from the outside, it's called clefts or indentations, okay? So this is basically the pharyngeal arches. And the reason I'm talking about them today is because the fourth pharyngeal pouch, if this is the first pharyngeal pouch, right? The second, the third, the fourth. If this is the fourth pharyngeal pouch, then you get the parafollicular cells from the inside of the pouch. The cells in the inside of the pouch, they form the parafollicular cells, and they start invading the thyroid. Okay, so they start traveling to the thyroid, whatever the location is. So here's the foramen cecum, actually, right? And this is the back of the tongue, and then the thyroid descends, right? So whatever the thyroid is, you will have these cells migrate, and they basically invade the thyroid tissue, and you can find it eventually like this beside the thyroid gland, okay? The parafollicular cells, okay? So let's read here. So thyroid follicular cells originate from the endoderm during development, and parafollicular cells, also known as C cells, arise from the fourth pharyngeal pouch. This is the first, second, third, fourth. This is the fourth pharyngeal pouch. Some cells arise from here, and they invade the thyroid gland. Okay, let's see some of these pictures. So this is a picture for the branchial cysts. And branchial cysts is basically, I'll tell you. So these arches are supposed to close, right? Are supposed to disappear. These clefts are supposed to disappear. Sometimes they accumulate fluid, right? And they form a cyst like that. This is called the branchial cyst, and this is actually laterally, you can see here. And you have to know it's a lateral mass, not a midline mass. Like if you have an ectopic thyroid or you have a thyroglossal cyst, it's going to be in the midline because this is where the thyroid travel. But this is a lateral mass, so this is a branchial cyst. Okay, most likely. I'll show you two cases in a minute. Okay, this is the fourth pharyngeal pouch. As you see here, this is the first, the second one, the third, and the fourth. Or this is the third, these two, third, and this is the fourth, okay? So the fourth, you have the ultimobranchial body, which gives rise to the calcitonin secreting cells, or the C cells. So as you know, guys, thyroid gland secretes both the thyroid hormone, T3, T4, and also the calcitonin by the parafollicular cells, or in other words, C cells. Okay, this is another picture for the pharyngeal arches. This is the back of the embryo, as you see here. If you take a cut section like that and looked from behind, you could see the neural tube, which is the brain of the baby. You can see the spinal cord, which is the continuation of the neural tube like that, right, from anteriorly. Or this is actually anterior, so you're looking from the anterior. This picture, you're looking from the anterior. So you can see the brain here, and you could see the inside of the pharynx. And from the fourth pharyngeal pouch, you could see the arising of the C cells, the parafollicular cells. Okay. Also another picture from of the pharyngeal arches. There are structures that arise in the neck, head and neck. Okay, let's see this case. A 10-year-old child presents with a painless swelling in the midline of the neck. The swelling moves up and down upon swallowing or protruding of the tongue. On physical examination, a smooth cystic mass is palpable in the anterior neck. Thyroid function tests are within normal range. What is the most likely diagnosis?
Cystic hygroma.
Cystic hygroma is actually a congenital abnormality in the lymphatics, and it's way larger, first of all, and it usually presents in a patient with like 2 years old, or even less than that, so 1-year-old patient, or right, congenitally actually, like in infants even.
So this thyroglosal
cyst. Okay, it could be an ectopic thyroid gland, right, that descends along the development, but this is the most likely diagnosis. The most likely congenital abnormality is thyroglosal cyst. Okay, so the thyroid normally descended, and that's why he has normal function tests of the thyroid, but it left as like a fistula between, or a duct between the tongue and the thyroid gland. So this tongue, this duct filled some fluid inside, and it formed a cyst. Let's see this case. 25-year-old female presents with a recurrent tender swelling on the lateral aspect of her neck. She reports that the swelling becomes larger and painful during upper respiratory tract infections. So this basically fills fluid whenever she has an infection of the upper respiratory tract. So try to imagine with me here. If I have a cyst here, if I have a cyst in the cleft, or like right here in the pharynx. So every time I have some kind of infection, I have inflammation, and I have dilatation of these blood vessels, and I get fluid inside the cleft, or inside the mass, right? Every time I have an infection. The upper respiratory infection is right here, right? So upper respiratory, and also a little bit of pharyngeal inflammation you get along with strep throat, for example, or influenza, right? You get a little bit of inflammation in the pharynx. So you get some kind of exudate, happening in this cleft. So that's why it becomes larger with infections. On examination, a fluctuant mass, and you should know it's fluctuant, right? So that's the movement of fluid, basically, is palpable on the anterior triangle of the neck. So laterally here. This is the midline, this is laterally, just below the angle of the mandible. So what is the most likely diagnosis?
Branchial cyst.
Branchial cyst. Okay, so now let's talk about anterior pituitary gland development. Yeah, before we talk about anterior pituitary gland development, let's talk about parathyroid gland development. So as you know, we have the thyroid gland, and we have 4 different parathyroid glands. We have this 2 superior and 2 inferior, right? And basically, if you guys remember the pharyngeal arches that I talked about, from the inside as well, the pouch, they also form the superior and inferior parathyroid glands, okay? So the superior parathyroid gland, because it's superior, right, it has the higher numbers. So it's the pharyngeal pouch number 4, okay, right here, along with the ultimobranchial body, which forms the parafollicular cells, right? So superior parathyroid is from the 4th pharyngeal pouch. The inferior, because it's inferior, so the lower numbers, so 3rd pharyngeal pouch. So 3rd and 4th pharyngeal pouches, okay? All right, so let's talk about anterior pituitary and posterior pituitary gland embryology quickly, and it's pretty simple, even though some people complicate it. So if you imagine the mouth development, or the mouth cavity development, you might think it's formed from endoderm, right? But I brought you to hit this picture in order to imagine the development of the mouth, because it makes sense, right? If you have the foregut, if you have the pharynx from endoderm, the foregut from the endoderm, the mouth cavity is considered a digestive organ, so it's also formed from the endoderm. But this is not true, because you have a little bit of the mouth cavity formed from the endoderm, yes, but you also have the anterior portion is formed from the ectoderm, okay? So it's called the oral ectoderm, and which makes the mucosa of the mouth. And it makes sense because in the anus, you also have this same phenomena. You have below the dentate line, you have the ectoderm forms it, and above the dentate line, you have the endoderm forms it, right? So same idea here. The ectoderm forms the anterior portion, starting from the anterior 2/3 of the tongue. That's why we, do this arrangement or do this division: anterior 2/3 and posterior 1/3. That's why we do it, because behind it we have endoderm, anterior to it we have ectoderm. Okay, so anyway, so if you see the back of the like the upper layer in the mouth cavity or the hard palate, in the beginning, of course, we don't have a hard palate yet. So we have an oral ectoderm. So what happens is you get something called a pouch. Like, we already know what a pouch means, right? It's like an indentation from the inside. If you guys remember the pharyngeal pouches here. Same thing here. There's an indentation in the oral ectoderm from the inside of the mouth. You could imagine it on yourself. Like, imagine if the hard palate, there's an indentation that came from the hard palate, like inside. Okay, as if you put your finger and poke a hole inside, right? This is basically the Rathke's pouch. This is its name, Rathke's pouch, which is an indentation that forms in the oral ectoderm. Okay, let's see here. So if this is the oral ectoderm, right, there is a pouch that got inside here. This is called the Rathke's pouch. Okay, Rathke's pouch. And then this pouch basically forms like a circular structure like that, and it leaves it alone, right? And eventually this Rathke's pouch, it's going to be the anterior pituitary gland. The anterior pituitary gland. And then the forebrain, this is the brain tissue, and it's weird actually that you get a gland from the brain tissue, but this is why we call it the adenohypophysis. Adenohypophysis is the anterior pituitary. Neurohypophysis is the posterior pituitary. That's why we call it the neurohypophysis. Okay, so neurohypophysis or the posterior pituitary comes from indentation of the brain, specifically the diencephalon. Okay, so the brain here makes it like an indentation, and eventually the neurons in the brain here are the ones that's going to secrete the hormones and store it in the posterior pituitary. We'll talk about it in a second, but I think you guys already know the idea. So the anterior pituitary is different originally from the posterior pituitary. One is formed from the floor of the mouth or the roof of the mouth, and one is formed from the floor of the brain. Okay, I have another picture here to imagine. If this is the roof of the mouth or the stomodium is the mouth of the embryo, and this is the floor of the forebrain, you have an indentation which is called the Rathke's pouch, right? And you have an indentation to the inside from the floor of the forebrain. One forms the posterior pituitary and the other forms the anterior pituitary. And it's pretty simple actually, okay? Even though people complicate it. But there are some weird names you have to know. So Rathke's pouch is the indentation in the inside. It's the pouch in the inside. Okay, anybody has any problem with this? Okay, so let's solve some questions. Share this. How is here? Oh, okay, so there's a wide variety of answers here. Okay, I'm pretty sure it said thyroid diverticulum is the first thing that, does this whole thing, right? And the foramen cecum is the last thing that exists. Okay, so let me explain that. So we said that the anterior 2/3 of the tongue, I have the posterior 2/3 of the tongue, right? There is a thyroid diverticulum, right, that forms in here, okay? So like an indentation. And the thyroid diverticulum starts, descending down, right? And then eventually you get the foramen cecum, right? So here the question says, which structure arises from the floor of the primitive pharynx and descends into the neck? Which one descends to the neck? The thyroid diverticulum, okay? And then after it, arrives in the neck, you have the thyroglossal duct here, the thyroglossal duct, which connects the thyroid, which already formed from the thyroid diverticulum, to the tongue, basically, okay? And the parafollicular cells, we said that they arise from the pouch, right, not from the tongue, and the foramen cecum is the last opening here in the tongue, basically. It has nothing to do with in the beginning, right? You cannot see in the beginning. Okay, foramen cecum. That's the normal remnant of the thyroglossal duct. This is not normal, guys. I'm talking about the normal remnant of the thyroglossal duct. This is not normal. Okay, this is abnormal connection between the thyroid and the thyroid in the neck, and the tongue in the mouth cavity. Okay, the thyroid. So ectopic site for thyroid tissue. Okay, the thyroglossal duct cyst is not thyroid tissue unless it converted to a pyramidal lobe, right? So when I talk about ectopic site, I'm talking about the location of the thyroid at which the thyroid shouldn't be in, like the behind the tongue, right? So yeah, this is the most common abnormality of the thyroid tissue, right? But I'm talking about ectopic site, right? But this is not thyroid tissue, guys. This is just a duct connecting between the thyroid tissue and the tongue, right? It's not thyroid tissue. Good job. Fourth pharyngeal pouch. Good job. Okay, let's continue. So now we understand the embryology of the pituitary glands, right? Let's talk about a little bit of physiology, or the hormones that are secreted. So as you guys know, there are lots of hormones that the anterior pituitary gland secretes. And like I said, another name, it's called the adenohypophysis, right? The adeno. So it's a gland, and it's formed from the oral ectoderm. You have to remember this, oral ectoderm. Okay, try to imagine it on yourself, as if your roof and your mouth roof formed an indentation that gets inside. So you get the adenohypophysis. Okay, and basically all the hormones that the anterior pituitary makes, right? It's formed from the alpha subunit and beta subunit. Specifically the TSH, the LH, the FSH, and the beta HCG. The beta HCG is not formed by the anterior pituitary, it's formed by the placenta, right? But it has the same structure here, right? So it has alpha subunit, which is a series of amino acids, and beta subunit, which is a series of amino acids. So alpha subunit is the same subunit in TSH, LH, FSH, and beta HCG. Okay, beta subunit is the one that changes actually. Okay, and the way I like to remember it is that alpha males don't change themselves, but beta males change themselves. That's how I remember it. So alpha chains, they don't change across different hormones. They have the same structure, but beta chains, they change accordingly. So this is the LH, you could see a different structure here. This is beta HCG, you could see a different structure. Okay, beta subunit, it determines the specificity of the hormone. So beta subunit is what says, oh, this is LH, this is FSH, this is HCG, etc., etc. Okay. So what are the hormones that the anterior pituitary gland secretes? We have several hormones. We have something called the FSH, the follicle stimulating hormone. We have luteinizing hormone, the LH. We have adrenocorticotropic hormone, ACTH. And just try to recognize the names here. Don't really worry about the functions right now. Okay, don't worry about the functions. Try to recognize the names as much as you can, and that they are secreted from the anterior pituitary. And actually, it's not difficult to remember because the posterior pituitary only secretes the oxytocin and the ADH. That's it. Or the vasopressin. It's not difficult. Anything else, that has an H in it, it's pretty much secreted from the anterior pituitary gland. So growth hormone, thyroid stimulating hormone, adrenocorticotropic hormone, luteinizing hormone, follicle stimulating hormone, right? Yeah, so these are the highest yield hormones that you should know about. There's another hormone, it's called beta endorphin. It's secreted as a byproduct of ACTH. I'll tell you what that means in a minute. Just one second. Okay, so pituitary gland hormones. What do we have here? There is a protein that the anterior pituitary gland makes. Okay, so the anterior pituitary gland makes a big protein. It's called POMC. Okay, and POMC stands for propionmelanocortin. Yeah, propionmelanocortin. Okay, I just remember it as POMC because the name is difficult to remember. Propionmelanocortin. Okay, propionmelanocortin. Okay, and this protein explains an important clinical presentation. We're not going to discuss it now, but I'm just going to tell you the idea behind it. So just know there is a protein that's secreted by the anterior pituitary gland. It's a very big protein, right? And by different proteases, okay, we break this protein down into different hormones, right? So we break this protein down into MSH, or melanin stimulating hormone, or melanocyte stimulating hormone, and endorphin, and the ACTH. Okay, it's a big protein that's secreted by the pituitary gland, the anterior pituitary gland. Okay, so let's say we're trying to increase the ACTH. Okay, we're increasing the synthesis of ACTH. That means we also are going to increase the synthesis of MSH and the beta endorphins. by the way, like as a byproduct, because we're making the entire protein first and then breaking it down to ACTH and MSH and endorphins. So whenever we're making ACTH, we have to make MSH as a byproduct. Okay, that's why some people with Addison's disease, where they have increased levels of ACTH in the blood, they have this phenomena where they have, you know, hyperpigmentation of the skin, because as they are secreting ACTH, they also are secreting melanocyte stimulating hormone. And we'll talk about Addison's disease when the time comes, not right now. Okay. All right. So there are lots of different cells in the anterior pituitary. In fact, all these, like every single hormone of these, there is a specific cell that, you know, secretes it. So prolactin, for example, is secreted by the lactotrophs, right? The cells are called lactotrophs, lacto from milk, or lactose, okay? Lactotrophs, because prolactin is important in milk synthesis. So lactotrophs, these are the anterior pituitary gland cells that make the prolactin. Growth hormones, or somatotrophs, okay? Somatotrophs are the cells that make the growth hormone, all right? So each one of these cells stain differently. So we have cells that, you know, stain basophilic, and they look basophilic like that. We have other cells that are, you know, stained acetophilic, and that are not really stained, or chromophobe, okay, or light purple like that. So the way to remember which ones secrete which hormones, just remember B flat, okay, B flat. Basophils secrete FSH, LH, right, FSH, LH, ACTH, and TSH, okay? And sometimes they ask you about this. They get you a picture like this, and they tell you, you know, this cell secretes which of the following and hormones, and they get you a different panel of hormones, and you have to select the correct one. I don't know what's the clinical importance. I don't see any clinical importance, but you know, it is what it is. So FSH, LH, ACTH, and TSH are secreted by the basophils. Okay, let's see this one. Acid pig. Okay, and pig is, you know, is pink, right? So acetophils secrete prolactin and growth hormone. Okay, as you guys know, the pig is pink. So acid pig acetophils, right? Acetophils which stain pink like that. So prolactin and growth hormones. Okay, so we talked about the anterior pituitary gland, and we said there are certain hormones that are secreted from the anterior pituitary. We have the FSH, LH, TSH, ACTH, growth hormone, prolactin, etc., right? The posterior pituitary gland secretes only 2 hormones, right? So it's easy to remember just the posterior pituitary, and then anything else is secreted by the anterior lobe. So we have oxytocin by the posterior lobe, and we have ADH by the posterior lobe, okay? And the difference between this and this is that the anterior pituitary gland itself, the cells itself, they are the ones that secrete the hormone. On the other hand, the posterior pituitary gland, there are certain neurons that secrete the hormones for it. And this makes sense because remember, the origin of the posterior pituitary gland is from the brain, right? So it makes sense that there are certain neurons with axons like that are the ones that secrete the oxytocin and the ADH and store it in the posterior pituitary gland, right? So it stores and releases the hormones in response to different effects, right? For example, oxytocin is released upon suckling, right? When the patient suckles on the mother's nipples, the oxytocin, basically there is a reflex that starts ejecting the oxytocin from the posterior pituitary, right? Vasopressin or ADH, whenever you have hyperosmolarity in the blood or hypotension, you get activation of the posterior pituitary to secrete ADH, right? So the hormones in the hypothalamus, they're basically made in these nuclei, the paraventricular nuclei and the supraoptic, and they are stored in the posterior pituitary gland. And you have to know that it's paraventricular and supraoptic. And just supraoptic means, you know, above the optic chiasma. This is the optic chiasma, okay? So supraoptic means above the optic chiasma. And paraventricular, there's a ventricle over there. So it's paraventricular, it's beside the ventricles of the brain, right? Which are fluid-filled spaces, as you guys know. So these hormones are made there in these nuclei, and they are stored, you know, they get through this stalk here, pituitary stalk. This is called stalk. and they arrive in the posterior pituitary, and then they are released. And you have to know that the posterior pituitary is derived from the neuroectoderm during development. Okay, so this is a comparison between the two glands. You have the anterior pituitary here, you have the posterior pituitary, right? The anterior pituitary gland secretes TSH, ACTH, FSH, LH, right? FSH, LH in males and females, growth hormone, lactin, right? These are the hormones that it's secreted by the anterior pituitary. What about the posterior? Only two, oxytocin and ADH. Okay, like very easy to remember actually. Just remember the two hormones, oxytocin and ADH, and it will be easy to just remember all the ones, right? And I want you guys to, whenever you're learning this, I want you to imagine the pituitary gland in your head, right? Let's say you're reading the anterior pituitary gland, like secreting a hormone here. I want you to imagine that there is a gland in your brain right now, the anterior part of it that's secreting this, right? And same thing when it comes to the posterior part that secretes the oxytocin and ADH. Okay, so before we take the adrenal cortex and adrenal medulla, I want you guys to take a 15 or 10 minute break, and then we'll come back to this.